Okay, so diving right in. Today, we are looking at a really pivotal moment for healthcare in the U.S.,
Hmm.
and that is the Senate confirmation hearing for Dr. Mehmet Oz, who was nominated by President Trump to head the Centers for Medicare and Medicaid Services,
CMS.
CMS, right? This is a
Yeah.
big deal.
Huge agency. Yeah, this is the agency that's overseeing Medicare and Medicaid, which are some of the biggest healthcare programs in the country.
Right, and Dr. Oz, of course, is well known for, I mean, his long career, right?
Yeah.
As a cardiothoracic surgeon.
Yeah, you know him as, the TV personality and the doctor.
Right, right. And so this hearing really matters.
For sure. And it's interesting, too, to see, he had that unsuccessful Senate run back in 2025, just 3 years ago.
Right, right.
And now this
Yeah.
is like a really big potential shift for him into a government role.
Yeah, yeah. So he actually faced the Senate on March 14th, 2025,
Mm-hmm.
to discuss like his qualifications,
Mhm.
for leading this agency that impacts so many people through programs like Medicare and Medicaid.
Yeah, millions of people. Yeah.
Right. Right. So we went through like all the news reports that we could find detailing this whole hearing,
Yes.
and we kind of put together this timeline
Mm-hmm.
of the key events to bring you the essentials. So our goal today really is to cut through all that political noise. You know what I mean?
Yes. Get to the meat.
Get right to it. Yeah. So what are the core issues?
Exactly.
What were the concerns raised during this hearing?
Yeah. And we really want to focus on, what this could mean for the future of Medicare and Medicaid.
Right. Right. You've probably heard the name Dr. Oz,
For sure.
but today we're going like beyond the headlines
Mm-hmm.
and looking at like what does it actually mean for him to potentially be the head of this agency?
Yeah. And what are the implications?
Exactly. Exactly. So, okay, let's just jump right in.
Okay.
Starting with like those opening statements
Yeah.
and like what were those initial points of contention?
So, in his opening statement, Dr. Oz highlighted, his medical background. And he also made sure to point out, that President Trump supports both Medicare and Medicaid.
Um,
It's kind of typical in these hearings to align yourself, with these really popular programs and the president who's nominated.
Right, of course, right. But then, almost immediately, Senator Ron Wyden, who is, the top Democrat on the committee,
Mm-hmm.
he voiced some really strong opposition. He did not mince words,
No?
and he specifically called out Dr. Oz's history of, promoting those Medicare Advantage plans
Mm-hmm.
and what he called baseless wellness remedies.
Yeah.
So right away, that kind of sets up this key area of concern.
Exactly. And so the thing that Senator Wyden was worried about was, that if Dr. Oz is confirmed, will he end up favoring for-profit insurance companies?
Okay, yeah.
Right? Like, that's a big fear. And so if he favors those companies, then that means he might support policies that help them,
Mm-hmm.
but maybe at the cost of people who were relying on Medicare and Medicaid.
Right.
So this brings up that question of, like, can the head of CMS,
Right.
who's appointed by the president,
Right.
can they really push back against budget cuts if that's what's politically popular?
I see. So, like, are they really there to, like, protect these programs?
Exactly.
Okay. And so Senator Wyden kind of got right at this, right?
Yes. He asked Dr. Oz directly, he's like, will you oppose any cuts to Medicaid and Medicare?
Right. I mean, you would think that's, like, the moment, to be really clear.
Yeah, you'd think that's a moment for a strong commitment.
Yes.
But, Dr. Oz, his response, it wasn't that simple.
Oh, really?
Yeah.
So what did he say?
He said, I cherish Medicaid. And he said he's, worked within the Medicaid environment quite extensively. So, it sounds okay on the surface,
Mhm.
but he's not really promising to fight against future cuts.
Right. Right. He's being very careful with his words, I guess.
Exactly. And I think that's strategic, in a confirmation hearing.
Right. He doesn't want to, like, lock himself in.
Yes, exactly.
So it sounds like that answer really frustrated Senator Wyden
Oh, yeah, it did. It did.
because it still leaves, the possibility of cuts happening
Absolutely. Absolutely.
if Dr. Oz were to be confirmed. Okay, so we've got Senator Wyden really concerned about this issue,
Mm-hmm.
but it didn't stop there.
Right. No, it didn't. Senator Maggie Hassan also had some really pointed questions, and she focused on healthcare access, especially for children.
Okay.
Like, what are his values around healthcare for kids?
Yeah.
And she asked him, straight up, how many children losing health insurance would be acceptable to you?
Oh, wow. That's that's a really direct question.
It is. It is.
I mean, I think anybody would say they don't want any children to lose health insurance.
Right. And Dr. Oz said that, he doesn't want any children to lose it.
Okay.
But then Senator Hassan, she kind of pushed him further.
Oh, really?
Yeah, she was like, okay, well, what about these Republican budget proposals?
Oh, right, right.
That could lead to children losing insurance.
Right. So she's kind of calling him out on like what's actually going to happen versus what he's saying.
Exactly. Exactly. Like, do your values really align with the policies that are being proposed?
Okay, so she really grilled him on that.
She did. And then, it got even more specific.
Oh, really?
Yeah, yeah. Senator Hassan brought up this thing from Dr. Oz's past.
Okay.
Back in 2012, he was promoting green coffee extract for weight loss on his show.
Oh, right, right. I remember that. Okay. So how is that relevant to, CMS?
Well, it's about his judgment, right? Like,
Right.
what kind of health claims is he endorsing?
I see, I see.
And she actually quoted him from the show. He called it a magic weight loss cure for everybody type.
Wow. Okay.
But here's the thing. The study that he was basing that on was later retracted.
Oh, no.
And the Federal Trade Commission, they said that the data was deeply flawed.
Wow. Okay. So that's kind of a red flag, right?
It is. It really makes you think, like, okay, how much weight should we give to his past endorsements?
Especially for someone who's supposed to lead, national health program.
Exactly. Exactly. And I think, it just shows how much scrutiny there is on these nominees.
Right. Because what they've done in the past can really come back to haunt them.
Absolutely. Absolutely.
Okay. So we've got Senator Wyden, we've got Senator Hassan, and then enter Senator Elizabeth Warren.
Oh, yeah. Senator Warren had a lot to say. She really went after Dr. Oz on several different fronts.
Like what?
Well, first, she zeroed in on his financial ties.
Okay.
He's got connections to a lot of healthcare companies.
Right.
And she was worried about conflicts of interest,
Of course, yeah.
Like, if he's got a financial stake in these companies, is he going to make decisions that benefit them?
Right, right. Instead of like, what's best for everybody.
Exactly.
Exactly.
Yeah.
So that's one thing. What else?
Well, she also brought up some of his past comments about potentially privatizing Medicare.
Oh, wow. That's a big one.
Yeah, and it's a really sensitive issue, for a lot of people.
Mm-hmm.
And so, I mean, any suggestion of moving away from traditional Medicare is going to be controversial.
Yeah, I can see that.
And it raises these really big questions about, what's the government's role in healthcare?
Right, right. And like, what does that mean for people who rely on Medicare?
Exactly, exactly.
Yeah. Okay, so financial ties, privatization,
Yeah.
anything else?
Yeah. Then she really got into it with him about his stance on abortion.
Okay.
She basically said he has a hostile record on abortion rights.
Okay.
And she brought up this comment that he made on the campaign trail.
Okay.
Apparently, he said that a woman's decision about abortion should involve not just her and her doctor, but also local political leaders.
Oh, wow. I can see why that would be controversial.
Yeah. And Senator Warren was really fired up about it.
What did she say?
She called it terrifying and
Wow.
said it goes against, basic patient health.
Wow. So like the idea that politicians should be involved in these really personal medical decisions.
Yeah, exactly. That really got to her. And it raises some serious concerns about, political interference in healthcare.
Yeah, yeah. And like, what does that mean for a woman's right to make decisions about her own body?
Exactly. Exactly.
Okay, so we've got a lot of like tough questions coming from the Democrats,
Mm-hmm.
but it wasn't all negative, right?
No, of course not. The Republicans were there to defend Dr. Oz.
Right.
They talked about his qualifications
Mm-hmm.
and, how much experience he has as a surgeon.
Right.
And they probably also liked that he was, aligned with President Trump's policies.
Yeah, of course.
Yeah.
Did they bring up any specific issues?
Yeah. One of the senators, Steve Daines, he brought up the Hyde Amendment.
Oh, okay. Now, for anyone who doesn't know, what is that?
So the Hyde Amendment, it's this federal law that's been around for a while.
Mm-hmm.
And it basically says that federal money can't be used to pay for abortions,
Okay.
except in a few cases, like if the woman's life is in danger,
Right.
or if the pregnancy is the result of rape or incest.
Okay, so it's a really big deal in the debate over abortion.
Absolutely. And so Senator Daines wanted to know, would Dr. Oz uphold the Hyde Amendment?
I see.
Like, would he make sure that federal healthcare programs weren't paying for abortions?
Right.
And, beyond those exceptions that are already in the law.
Okay, so what did Dr. Oz say?
He said he would uphold it.
Okay.
He said he would make sure those restrictions were followed.
So it just shows how, like, this issue of abortion just keeps coming up.
Yeah, it's so central to so many discussions about healthcare.
Right. Okay. So we've got the Democrats grilling Dr. Oz.
Mm-hmm.
We've got the Republicans defending him.
Yep.
But then, kind of late in the game, this whole other issue comes up.
Oh, yeah, the tax returns.
Right. So tell me about that.
So apparently some staff from the Senate Finance Committee, they were looking into Dr. Oz's taxes.
Okay.
They were looking at his returns from 2021 to 2023, and they came out and said that he might have underpaid his Social Security and Medicare taxes.
Oh, wow. So the taxes that go to the programs he's supposed to be in charge of.
Exactly. Exactly.
Okay, so how did that supposedly happen?
Well, they said he used this thing called a limited liability company,
Okay.
and that maybe let him avoid paying hundreds of thousands of dollars in self-employment taxes.
I see. So these LLCs, they can sometimes have different rules for taxes.
Right. And so there's this debate about whether he was really supposed to pay those self-employment taxes.
And of course, those taxes are what fund Social Security and Medicare, right?
Exactly. So, I mean, it's a pretty big deal.
Yeah, it makes you wonder about his commitment to those programs.
Right. If he's trying to avoid paying into them.
Okay, so did Dr. Oz respond to this?
Yeah, his team said that he wasn't actually liable for those taxes.
Okay, so they're disagreeing with the committee staff.
Yeah, it's a big disagreement.
Okay. And, I mean, this is typical, right?
Oh, yeah. They always scrutinize the nominee's finances.
Especially for a job like this.
Exactly, where there's so much financial oversight involved.
Okay, so we've covered a lot of ground.
Mm-hmm.
But there's one more thing I want to touch on.
Okay.
And that's Dr. Oz's stance on these Medicare Advantage plans.
Mm-hmm.
It's a really big part of the whole debate about Medicare's future.
It is. It is.
So Dr. Oz has been a supporter of Medicare Advantage for a while.
Yes. And in June 2020, he actually co-wrote this op-ed in Forbes.
Okay.
And in that op-ed, he proposed expanding Medicare Advantage to cover everyone who's not on Medicaid.
Wow. So, like, way beyond what it covers now.
Yeah, it was a pretty bold idea.
And how would he pay for that?
He suggested a 20% payroll tax.
Oh, wow. So basically a new tax.
Yeah, a big one.
Okay, so that's a pretty strong statement in support of Medicare Advantage.
Absolutely. And it wasn't just that one op-ed.
No.
He also promoted Medicare Advantage a lot on his show.
Right, right. So this is clearly something he believes in.
Yeah, for sure. And I think it's important to understand, like, what Medicare Advantage even is.
Okay, yeah, good point. Remind us.
So it's basically a way to get your Medicare coverage through a private insurance company
Okay,
instead of directly from the government.
right. So what's the debate about?
Well, some people, like Dr. Oz, they say it gives people more choices
Mm-hmm.
and that the competition between these private companies can lead to better care.
Okay, that makes sense. What about the other side?
Well, others are worried about, these companies prioritizing profit over people.
Right, right.
And they're concerned about people maybe having to pay more out of pocket.
Okay, so it's a really complex issue with a lot of different perspectives.
It is. And, this guy, Joe Albanese, he's a policy analyst at the Paragon Health Institute.
Okay.
He points out that Medicare Advantage has become really popular.
Mhm.
A lot of people are enrolling in it.
Okay.
And he says that this is changing how the government is involved with Medicare.
I see. So it's like a fundamental shift in the whole system.
Yeah, potentially.
Okay. So to sum it all up, this hearing was a whirlwind.
It was.
I mean, we had concerns about cuts to Medicare and Medicaid,
Hmm.
questions about Dr. Oz's past endorsements,
Yeah.
worries about his financial ties,
Hmm.
debates about abortion,
Yeah.
and then this whole tax issue.
Wow, it was a lot.
It was a lot.
Yeah.
And for you listening, it's so important to understand all of this.
Hmm.
I mean, these programs, they affect so many people.
Millions and millions.
It's about their health, their well-being, their financial security.
Exact.
And whoever's leading CMS has a huge impact on all of that.
For sure. For sure.
So I guess the big question is, what does this hearing tell us about healthcare in America today?
Yeah. And, how much should we care about a nominee's past when we're thinking about whether they should be in charge of something this important?
Right. I mean, it's not an easy answer.
No, it's complicated. There's a lot to think about.
Yeah, there really is.
Yeah. Mhm.
Okay, well, that's all the time we have for today. Thanks for joining us.
Absolutely. Thanks for having me.